Hi, Dr. Minkoff here. Last week I was seeing a patient, and that patient had been seen by another physician and had given them a solution which had been going on for about 9 years, and the patient was continually getting worse. And it just hit me that this patient had presented 9 years ago with a bunch of symptoms that added up to Parkinson's disease. And a brain MRI had been done, and the neurologist decided this was Parkinson's disease and had given the appropriate prescription medication, which was L-Dopa, and had followed the patient for 9 years. And after 9 years, she was going downhill, and she had ended up in our office because she was looking for something that might work better, because he told her that the natural progress of the disease was going to be a steady decline because the medication stopped working, and then there wasn't much that he could do. So it occurred to me that since our approach is really different, I'm always trying to figure out, like, what's my job? Well, my job is, why do you got what you got? For most people, it's not genetic. You didn't have it 2 years ago or 5 years ago. Until that point, you were fine. And then something happened, or some things happened, which gave you the problem that you have. So until 9 years ago, this person had no appreciation that she had Parkinson's disease. She's in her middle 60s now, and up until probably 55 years old, she was active. She played tennis, she went out, she did what she did, and then she started to feel gradually that she had less and less control over her body, and so she went to the doctor to find out why. And he didn't really find out why. He made a diagnosis based on symptoms and very little workup. And so when I saw her, it just hit me of, gee, there's probably a lot of things that added up to her getting what she got. And so I started to investigate her to say, could there be some things that got into her body or things that were missing from her body that caused her to get what she got? So the first thing I did, oftentimes dental problems can add up to neurological problems, especially dental infections. So I examined her, and I sent her to a dentist to get a specialized, called a cone beam CT. It's a CT scan of just the teeth. And I wrote on the prescription, rule out abscess. So that report came back, and it said that this person had 11 abscessed root canal teeth. Now that's a lot of abscessed teeth, 3 inches from the brain. Could those toxins from the abscess, from the bacteria that are in there, trickle back and affect the cells of the brain? You bet they could. We know that almost all people who have coronary artery disease, if you ream out the plaque and you culture the plaque, or you do specialized microbiology on the plaque, that almost all of them are infected with dental infections. These can be pockets in gums, they can be from abscesses and root canals. So we know it goes all over, but this isn't very far to go. So that was, well, that could be a why or a what. Then I did another test on her, which was a urine test for mold toxins. And the particular lab that we use tests for 4 mold toxins. And she had the highest levels of mold toxins that I've ever gotten, and I've been testing these things for 10 years. Like 20 times acceptable levels of mold toxins in her body, coming out in her urine, which means that she's living in a really moldy house, because these molds grow and they put out these toxins and they breathe them in. And we know that mold toxins are extreme brain toxins. In fact, we do a test on people with mold where we're able to have them look at a particular image to see how well they can separate very fine lines, how close they are. It's called a visual contrast test. And people who have mold toxins think that these two things are the same. This is crude because this is on a piece of paper. But if your brain is really sharp and it's really good, you can see really little skinny lines that are very close to each other. You can say, oh yeah, those are different. So we know mold toxins are a brain toxin. Okay, so that was another one. We also did a stool test on her, and we found that she was infested with 2 different parasites. Now, parasites also produce toxins that can infiltrate into the body and cause problems. She also had some pathogenic bacteria in her gut, and we were able to measure her urine for toxins that these bacteria make, and she had a lot of those. So here's someone who's got these things. And then the last one was, a lot of times when people have brain problems, they have problems with the upper 2 bones of their neck, where the bones are a little twisted and it chokes off either the blood supply coming out of their brain or the cerebrospinal fluid flow in their brain. And she had a twist of her upper cervical vertebrae. It was blocking off the normal circulation of her brain, and that was another problem. So after I saw her, I said, boy, we found a whole bunch of whats and whys. And if we fix these things, there is a chance that we can get your body to now heal because it's been suffering from these things. Now, I can't promise her that she'll be normal. I don't know that. But I know that in the past when we've had patients similar to this, they often really do improve. Because when we get these toxic influences off of them, their body's natural innate intelligence will start to heal. But if you don't address those things and you just give a medication designed to block symptoms, they're not going to heal. So if you're diagnosed with something simple, let's say you've got a sore throat and you go to the doctor and he does a swab and you got strep, now that's easy, okay? You get a medication for that, in 10 days you're fine and it's done. But if you've got something like you're tired all the time, or you can't think, or you've got brain fog, or you've got Parkinson's, or you've got MS, or you've got cancer, or you've got rheumatoid arthritis, or some other autoimmune disease, it isn't a lack of a particular medication that caused your problem. It's a lack of the doctor finding out what and why is wrong with you because you didn't have this before. And if we find the right things, we can give the right treatment that will heal without harm and improve you. So if you're in that situation, start looking around because there is help available and you can get better than you are now. Hope this helps.